So, people who have high cholesterol can start to have issues with their eyes. So, they can have like a gray colored halo that goes around their iris, which is called arcus senilis. And then they can also have sharply demarcated yellow patches on the inner canthus or eyelids, and that's known as xanthelasma. So of course you're gonna want to check a lipid panel. If you ever notice that, you should always immediately think cholesterol. So of course you're gonna check a lipid panel, and you're going to increase the statin doses and or lifestyle modification. So of course, if they're not on any statins, depending on how high the lipid level is, you may want to put them on a statin, or you can also just try the 3 months of lifestyle modifications. And so a pterygium, the best way to remember that is that it crosses over the cornea. And it's like a pink triangular shaped spot, and the cornea is involved, the vision is affected. So the treatment for that is possibly surgery, or you're going to need like UV sunglasses. The next one is a panicula, which if you can remember that by the N in there, because it does not cross over the cornea. It's like a yellowish raised spot, and the vision is not affected, but you still need to wear UV sunglasses. So eye emergencies, acute angle closure glaucoma. So sudden severe pain. It's like firm to the touch and it's cloudy. So you need to think eye pressure is sky high. So you'll do a tonometry test for that, which measures the intraocular pressure in the eye. And this is an emergency because the patient is at risk for a permanent vision loss. Retinal detachment, the easy way to remember that is it's like a curtain being pulled down over the eye. And then they'll also see floaters too. Blurred vision and flashes of light. So conjunctivitis, there are 3 different types of conjunctivitis. So allergic, it has like a serous, stringy, rope-like drainage. And then they're going to have cervical chain adenopathy. So like here, back here. Both eyes are involved in allergic conjunctivitis. With viral, you're going to have serous drainage, and then you're going to have preauricular and submandibular lymph node swelling. And so it usually only presents on one side, and then it moves over to affect the other eye. And then with bacterial conjunctivitis, you're going to have purulent drainage and no lymph node swelling. And then it's also a unilateral presentation, but then it ends up spreading over to the other eye. And so iritis, which is also called anterior uveitis, it can lead to permanent blindness, okay? So it's the inflammation of the uvea, which is the middle layer of the eye, and it presents with redness and swelling without discharge, constricted pupils, photophobia, and trouble seeing. You're going to refer to the ophthalmologist immediately, and they are going to put them on steroid eye drops. Aging eye complaints like cataract, so it's bilateral vision change due to the myopic shifts, and the screening is going to be an absent red reflex. Remember I said that the red reflex should always be present. If not, that's a problem. So if it's absent, that could possibly be cataract. So some signs and symptoms are trouble seeing from distance and driving at night. There's like a glare when you're driving at night, halos around lights, and foggy blurred vision. Macular degeneration, signs and symptoms are slow or sudden painless loss of central vision. So they start to lose their central vision of the eye, and it is the number 1 leading cause of blindness. And to help people who have macular degeneration, you're going to need to do things in large print. So like seeing things bigger, help them with that. Presbyopia is gradual loss of your eye's ability to focus on nearby objects. It's also known as farsightedness, and it's normally seen in patients in 40 years or older. And it's also referred to as the short arm syndrome. So patients claim that their arms seem too short. So eyelid bumps and lumps. So a sty or a hordeolum. It's a hair follicle infection or an abscess. It's an acute onset. There's eye pain, tearing, sensitivity to light, and purulent drainage. There's mild to moderate swelling. If you think of horde, the beginning of the word, you can think of hard, and it's painful. So warm compresses and antibacterial eye drops and ointments will help with that. A chalazion, which is a blockage of a duct or an oil gland. It's a gradual onset, and it's mild irritation and blurred vision. And there is moderate to severe swelling. So if you think like lazy, it's painless. It doesn't hurt. And you can do warm compresses or antibiotics and steroids if severe. And so on the Woods lamp or black lamp evaluations, to see a corneal abrasion, you're going to stain it with eye drops, and you would be able to see like the little or big. Some of them are really, really big. Fern lines are identified with eye staining drops as well, which would tell if a person has herpes in their eye. So a corneal abrasion is acute onset of severe eye pain with tearing and light sensitivity. And it's a foreign body or a sand sensation, so it feels like gritty in the eye. And it's associated with acute eye trauma or Bell's palsy, which is likely from poor lubrication. So if a person ever gets Bell's palsy, you always want to have some type of eye drops to keep the eye lubricated. And a corneal abrasion is diagnosed by a Woods lamp with fluorescein eye staining, and then you would prescribe antibiotic eye drops for that. For herpes keratitis, it's a infection of the cornea, and there's tearing, redness, foreign body sensation, and photophobia. So you would also use a black lamp exam to visualize the cornea, and you would see like fern-like lines on the corneal surface, which I've never seen, but I think that would be gross. And then you would treat it with antivirals such as a cyclovir. And that concludes part 2 of the eye portion.